Steve Staten, and this is part one of a two-part video on installing a low-pressure voice prosthesis made by Blomsinger. We got requests and a lot of emails from people who had viewed our first video on installing our hands-free device, and they said they want me to go back further, so here we go. I use the Blomsinger gel cap system. This is the gel cap loader. It comes with two sizes. One is 16 French and one is 20 French on this. It has two sides, a top which you're viewing and a bottom. This is a puncture dilator. You put this in for 8 minutes and this stretches out your puncture so that you don't damage tissue when you're inserting your prosthesis. This is the prosthesis itself. That is an inserter tail on it, and this goes on the inserter stick. If you look at the back side, the esophageal side, that's a flap, the valve itself, that keeps moisture and food from falling into your lungs. This is the tracheal side, which air actually travels through to allow you to speak. This is the inserter stick. Only use the inserter stick that comes with your prosthesis. They come in different lengths. If you use the wrong length, if it's too short, it'll fold when you try to put it in, the prosthesis. And if it's too long, it'll damage the valve flap in the back. This is the push stick. The push stick is used just to get prosthesis out of the gel cap loader. Before I load up and before I put in my prosthesis, be sure that you use KY jelly. Just a dab to lubricate before you put anything through your prosthesis. The whole idea of this procedure is to be easy on your tissue. It may prevent leaks. Okay, so right now I'm going to load up a prosthesis. The top side of your gel cap loader that I'm going to use is 16 French. If you notice, there's a small groove that goes all the way around the hole. That's where the actual gel cap fits in. Now I'm going to put this in. You put the tail in the top side.
That's the 20.
You pull it through gently. Now you bury the outside flange just inside the edge. And it looks like that. These gel caps are activated by liquid. Once they become moist, they disintegrate in 3 minutes. So, you also only use the clear side. You throw the red side away. You place the clear side inside the groove so that you can push the prosthesis into it. This keeps the flange small so it goes through your puncture easily. You take your push stick and put on the tail side of your prosthesis. You slide the prosthesis over the end of your inserter skin and hook the inserter tab under the post. Now, before I remove my old prosthesis, I want to lube this up, and I'm going to have it ready for me. The easy way is to stick it in the tube. My prosthesis, I cut the tail off because I use hands-free, so I can't remove this one with the pair of tweezers. I throw it into peroxide to clean it up, but ordinarily I'd do it, I would wash it first with antibacterial soap. It sits in the peroxide for 24 hours. I'm speaking without a prosthesis right now. The prosthesis isn't what makes you talk. It just keeps your puncture open and keeps fluid from coming in. You insert this for 8 minutes. And when I insert it, the camera's going off, and that will be the end of part 1.